Good morning, and thank you, Governor Bryan, for the opportunity to have this panel discussion today. I want to welcome everyone, including our Cigna representatives on the panel. We have Dr. Vittilio, and some of you may remember him as he was our keynote speaker at our recent Health and Wellness Expo. We have Rick Price, Mina Ayad, and of course we have Ms. Valerie Daly, our Group Health Insurance Chief at Division of Personnel, along with Ms. Beverly Joseph, our GESC Chairwoman. Again, thank you for joining us today. Today, we will present a comprehensive overview of the health and insurance matrix for the employees of the government of the Virgin Islands. This report aims to provide a detailed analysis and insights into several critical areas. Our goal is to offer a thorough understanding of the current health and insurance landscape, helping us to make informed decisions and strategic improvements. Some of the topics that we'd like to make sure that we cover today will include a total health insight overview, which are detailed analysis of significant cost drivers and overall health expenditures. The population health section, which examines prevalent chronic conditions, preventative care utilization, and demographic health trends. The catastrophic summary provides insights into high-cost claims and their impact on overall spending. Specialty pharmacy features on evaluation of spending on specialty medications and identifies potential cost-saving opportunities. A cancer summary, which overviews cancer prevalence, costs, and screening rates, along with our behavioral health breakdown on our mental health needs and trends. And finally, we have strategic recommendations for improving health outcomes and managing costs. So again, I appreciate your attention here today, and I'm eager to engage in today's discussion with everyone. So at this time, I'll turn it over to Cigna so they can talk and give us a summary of their CAHPS report.
Thank you, Director Richardson. I'll jump in here. Again, Rick Price, Director of Analytics at Cigna Corporation, and annually we have the opportunity to meet with the board, the Division of Personnel, and review a fairly comprehensive and detailed presentation about what's going on with the government's costs, utilization, claims, and most importantly for today's discussion, health. What is going on with people's health? Because ultimately, it's that health outcome that is the biggest driver of healthcare costs and therefore your premiums. And the affordability for everyone on the islands as employees, as spouses, as dependents, and the government itself paying the other portion of the premium. So there's a number of exhibits, Director Richardson just mentioned, that we go through. The first page there in the report is a multi-year trend view, which when this compilation was put together, it was very important to look pre and post-pandemic. With COVID-19 and the impact that certainly had significantly here in the Virgin Islands and across our country in general, and how deferred utilization became a very significant factor in people's health throughout 2020 and then into 2021. And we're going to look at kind of the rebound of that, as we were just saying, where we've...
I can understand what that means.
People not having appropriate services at the appropriate time, Governor. So one of the key areas is cancer screening. So we have evidence across the country of cancers being identified later because those services did not occur in second quarter 2020 into 2021. And we're recovering as a country, as an industry, and here for the government's employees. But we want to highlight that, as Director Richardson said, something we need to work even more to achieve better. So that first cost exhibit is really looking long-term, what happened, and then we get into a real deep focus on the policy year itself.
Well, I want you to stop a second because they can't see the slide on the TV. So when you show what costs have been, how they've escalated over the last 5 years from 2019, where it was at $6,079, and now it's at almost $8,000.
So the government's averaged about a 6% trend over the past 5 years, which is just a little bit above inflation
Right.
in the country during that time. Within that, there was a pretty big deferment in 2020. Again, that's millions of dollars down. And then COVID treatments itself bumping up costs in 2021, and the beginning of the return of all that deferred activity that hits the plan. We end up at just about just under $8,000, as you said, Governor, per person in cost in the most recent policy year. And that brings up a really good concept, is that we're talking about the health of the employees,
Right.
but the government beyond 10,000 employees also covers 10,000 spouses and dependent children. And their health is just as important as every employee's health outcome. And we'll see that throughout, as we were just mentioning. One of the topic areas is mental health
Right.
support needs. And there is a very significant driver of that amongst the dependent children that are enrolled in the government's plan, and how they need that support at the right time and the right place in their care as well.
So do you want to talk a little bit about what the drivers are? What is that trend looking like? What are some of the issues that we're seeing here within the territory?
So number one issue in the territory is cancer spend. With most populations in Cigna's book of business, we would see cancer as one of the top 3 categories. For the government's population, it is...
And when you say that, the top 3 categories, is that in incident or in cost?
in cost.
Okay.
In cost.
I want to make sure we get it right for the people, because, there's a lot of talk about cancer being the number one driver in terms of incidence. But in terms of incident, it is more high blood pressure and heart stuff, right?
Absolutely.
Yeah.
Yes, and we'll see that, sir, in just a moment.
Yeah, do you want to touch a little bit on maybe some of the prevalent forms of cancer that you're seeing here locally?
Sure. So we see overall just about a 2.5% cancer rate amongst the population, amongst the 20,000 individuals. It's not surprising. Breast cancer is the most prevalent item. When we look at the demographics of the group, breast cancer.
Wow.
Demographics very important in terms of healthcare outcomes and spend, certainly. Prostate cancer second. And that's where that...
Say that one again, because I think that's the one that really alarmed me too, prostate cancer.
I might add that those are the 2 that are also growing at the fastest pace.
Right.
So they also present a huge opportunity, and both of those are very amenable to screening. And
So you gotta say that. I like when you say it's amenable to screening. If we catch these things early, we're not going to be having to deal with that. So it's important that people go and get
correct
their checkups.
Absolutely.
And not only will it identify them, but the treatments will be simpler. They'll be more likely to be effective, and they will ultimately save money too.
Right.
So it's a win-win.
So those are 2 that are higher than what we typically see.
I want to say it again, because when I read this report, those are the things that alarm me, right? Like, we're dying and being affected by 2 things that if we just go to the doctor and check, it's avoidable. Mm-hmm. We won't have people actually, now I remember when cancer was a death sentence. And now when people tell me, like, they usually what I hear is, I found something. And then they have a treatment and most people are okay. But if it's too late, then it really gets expensive. And it's traumatic to the family and the loss, definitely. But the financial trauma going through that is also traumatic and have lasting effects for decades to come.
And that is why, as a board, and working with DOP, we encourage them to do
DOP?
Division
No,
of
I'm just saying, because people are,
Division of Personnel. We work together to make sure that they do the preventive services. Mammogram is a preventive. Prostate is a preventive services. It's on your plan. If you go to the doctor and you make an appointment to do your yearly mammogram or prostate, and they charge you, please call. You are not supposed to pay, not even a copay, when you go for those services. So if you call Group Health and you let them know, you can call the Cigna rep and let them know. They will send someone to that provider because probably they're using the wrong code because you shouldn't pay. So there's ways that we're asking you to get a hold before it gets to that catastrophic point.
And men, it's not a digital test. You could get the blood test too. You know, and I mean, we laugh about it among our friends, but for me, I mean, it's very important because black men are reluctant to go to the doctor, and black West Indian men don't go to the doctor unless they're dying. You know, so that alarmed me as well reading this, that, you know, but I'll let you keep on because high blood pressure is another one of those category where when I read this, I was like, well, people are not taking the medicine. No. You know, but let me let you continue with your presentation.
No, I think that's right along the lines of where we would go next in the opportunities, right, in the population. So identifying cancers early is probably the first item after getting people in to engage with a physician for the very first time. And I think, you know, I've been working with the government for years and years now, and we've seen progress. Right? Things are improving. The wellness program has an impact. You have 2,000 people having a blood draw without a claim, right? We have the wellness vans out there, and things are moving in the right direction. We still need to get more people in for breast cancer screening, for colonoscopies, for other types of colon cancer screening. And the last item on cancer I would add is our skin cancer identification rate is extremely low.
Really?
Extremely low.
So how does 2.5% in terms of the cancer incident compared to the rest of the country?
It's right on average.
Okay.
2.5% is right on average. But
and the one thing I found, and that was also interesting to me, is I had the opportunity to review the Medicare and Medicaid portion. So this is Cigna government insurance. But if you look at the Medicaid, it's the same exact statistics. So this is a reflection of what we're doing in our community in terms of dealing with illnesses and dealing with health, rather. One of the reasons why the Healthier Horizons program and prevention is so important to us when we look at this. And I know I'm jumping ahead in your thing. I have a tendency to take things over, but the other thing what really surprised me is your pharmacy summary. Yes. And then the compliance rate. First of all, people participating in the pharmacy summaries. You could talk a little bit about that. How are people taking their medicine and doing what they're supposed to do?
Absolutely. So that's an excellent question, Governor. So how are patients taking charge of their own personal health? And as a pharmacist, the very first thing I can say is drugs are only as good as the patient's taking them. So if a patient is inadherent, we can expect the therapies to escalate. We can expect hospitalizations on the medical side to occur. So we are constantly outreaching to members to remind them of their adherence, to remind them of those refills that are due, to make sure that patients are taking those medications for chronic diseases and maintenance medications, hypertension and cholesterol, even when we think of mental illness, right? It's very important to stay adherent to those medications. So Cigna's constantly outreaching to those members, and as I'm sure the pharmacies here on the island are doing so as well, to ensure those adherence levels are brought up.
So when you say, if you're just taking, the doctor gives you a prescription, you just go to your drugstore, neighborhood drugstore, and you get that prescription. Do you have to be part of the pharmacy program at Cigna to get that notification? Because, I mean, the Cigna app is great. My Cigna on my phone, I have that, it has your card and everything on it. But this is reflective of the people who are just participating with Cigna's pharmacy program or prescription taking overall?
This is everything that you're seeing here on this particular slide is everything that is occurring under the pharmacy benefit. So not necessarily occurring at a Cigna pharmacy, but anything that's processed under the insurance.
So you would know, like if you know somebody gets a 30-day refill and they don't go in for the 30-day refill for 60 days, they're non-compliant.
Correct.
So how do you notify people that are non-compliant that don't have the Cigna app or don't? How does that work?
So there's multiple outreaches. And first and foremost, everything that comes from an adherence perspective is mostly taken charge at the neighborhood pharmacy. So most of the neighborhood pharmacies are doing those proactive outreaches. Now, in regards to what Cigna is doing, we do have those mailings that go out. We also call, but there's only so many things that we can do to get to the members and get them to own their own health care. So Cigna is doing everything that we can and in our power to get those members to be adherent.
And I said that not to be critical of Cigna, but to remind people that these are benefits that you're paying for, that you should have the Cigna app on your phone, and you should allow it to send you notifications. I mean, I get them in my email. You still haven't registered for this. You have your this is late, and they're great. We also have programs in Cigna in our healthcare plan that where Cigna is actually managing your health for you and giving you assistance in terms of your diabetes or your hypertension, and giving you those advice to live your lifestyle choices. These, well, they're free seemingly to you, but you pay for these, and you should be taking care of them. But what really alarmed me again is, so my doctor, I didn't really used to like to take my hypertension medicine, and he told me, he says, you know, you're not overweight, you know, you exercise pretty regularly, and you have hypertension, that means it's genetic. He says, so no matter what you do, you're gonna have to take this medicine, and if you don't take this medicine, you're gonna die. And he gave me the example of a lady he had. She's a marathon runner. She just stopped because she was running these marathons. Couldn't be healthier. She had a stroke. When you look at our compliance rate for hypertension medicine, it's 55%. Diabetes, 51%. That means that only half of the people who are supposed to be taking this medicine is taking this medicine. That's what he said, right? Depression, 61% is a little higher. Cholesterol, 52%. And these are all the things that are killing us, avoidable.
So if I might make a kind of a point upon your point, you have 93% of the population has at least one chronic disease. These diseases you just mentioned are considered chronic diseases.
Wait. Say that again, 93%.
Have at least one chronic disease. And 80% of those have two. It's really 79%, but between friends, let's call it 80. Have two chronic diseases. So when you add hypertension on top of diabetes, both of which are very treatable, you now really increase the risk of the number one killer, which is heart disease. And then, of course, you add in cholesterol, which is the number 4 on this list. That is the third big piece of the puzzle. Only cigarette smoking is out of the graph here, but that would be the 4th absolute risk for the number 1 killer.
We don't smoke cigarettes for the most part.
We don't smoke, but we don't go to where Dr. V is stating. On our plan, we have about 30,000 plus, and 8% are healthy. I'm the director of operations for Medicaid. We have 24,000. All are sick with more than one chronic condition. I'm an active employee, and I have 3 chronic conditions.
But you know, these are the things and why we want to bring this conversation to the public, right? Because a lot of this stuff is avoidable if we just do what we're supposed to do. And people laugh when, you know, during COVID, they had this big thing because I got irritated one day and told people, you're afraid to take a vaccine and you sluxing down all of this food, shoveling it in the mouthfuls. Right. And this is my point, is like you worried about COVID killing you, right? And look at all these things you're doing every day that's killing you. And when I say this, I am not preaching to the choir because I don't like to take medicine. I don't like to exercise and stuff, but I do it as much as I can. But 55% on average or thereabouts of us taking our medicine that we need to take to survive, we have to do better than this. I mean, we should be our brother's keeper in this. We should be making sure that our people, the people you love, are taking their medicine. 90% of us, I can't believe that though. 90% of us have a chronic disease.
90 of us have it.
Over 90% of high-cost claims.
Right.
Oh, okay. That's a little better. That's a little better. That was scaring me. I was like, man.
It's still almost half the overall population, but
50%.
the really high cost claimants for the plan.
So
I think we need to understand, Governor, Cigna represents the active and under 65. So that is alarming for us because you're young people, and like you say, our culture, we put everything as it's gas. We delay going to the doctor and having a relationship with a personal care attendant until that pain gets too far gone. And by that time, what Dr. V and everyone, what is treatable becomes now catastrophic, which becomes a big paid claim, which rises premiums and deductibles, and everyone complains the insurance is too high. But you have so much people, it's a group plan. So you're healthy, Governor, and you're taking your medicine and adhering. I am not. I'm going to drive that cost. So I think people need to have a face to understand. You're open, you have diabetes, you have hypertension. I have hypertension and cardiovascular and musculoskeletal. So that's 3 big out of your list that's driving the cost.
wow. And then the diabetes is killing me because I guess this is type 2 because type 1 you die really quick.
Yeah.
So this is type 2. So
So, since we're talking about cost a little bit, can we talk a little bit about some of the catastrophic claims? Now, although that accounts for maybe just 1% of the population, it also accounts for about 32% of the total cost. Can we touch a little bit on that?
1% of the population, 1% of people cost 32%.
Correct.
So, I mean, when you look at, I like to equate it to dollars. So when you look at last year's numbers, we were at 204. So that means that $60 million for 1% of the people.
You're close because when we do the breakout here, based on what I have, it's coming up to about 52 million. So you're in the right range. So do you guys want to talk a little bit about that?
Sure. Do you want to start? Okay. Again, the big ticket item is cancers amongst the population. And some, as we were saying, are unavoidable, right? They're pediatric or leukemia or lymphoma or something of that nature, but many are screenable. And if we could just, maybe share one quick book of business statistic, like you were saying, Governor, across our entire population at Cigna, when we see cancers caught in stage 3 and 4 versus 1 and 2, the costs are double for the 4 main types that we can catch early. So breast,
is the survival rate too, right?
the survival rate would be impacted absolutely as you get into the later stages. And that is, as you were alluding to, it's more than just cost. It's also the health impact on that individual.
Absolutely.
Think of what they're
And the
going through.
family.
And the family.
Yeah, because if you get sick, your wife, your daughter, your son, your grandmother, they got to go with you. You got to go get these services in the States. They got to get a hotel. They got to camp out. And then it's like some people can't afford to do that with some of these illnesses. The thing about this that's even more alarming, and why I want to make sure that you're listening to this, we're getting worse.
Yeah.
It's like we're not getting better, we're getting worse, That is scary.
I think some of our programs are bringing people out of the woodwork, if you will.
Absolutely.
We're discovering them. So it looks like it's worse, but I think in the end it might actually end up being better because we're discovering them. And also, to be fair, clinically, a lot of these other cancers are discoverable with a good examination. Even lymphomas, an x-ray, simple x-ray sometimes will pick up lymphomas, or a good exam of the lymph glands. So even the other cancers are imminently discoverable.
I must say with the GSC, though, that they have actually set the health trend in the Virgin Islands because the government has 20,000 people covered. That's essentially 25% of our population. If the government starts to do 10,000 steps a day, drink water, whatever we start to do, the community adopts. And I was totally blown away by the amount of people. So we had, earlier this summer, we had the IRT. I'm not going to remember what it means. But then we had like 300 doctors, dentists, optometrists, dietitians descend on the area for free for a week. And I couldn't believe the amount of people that were actually accessing service. So the culture is changing, to your point.
May I jump in and ask a question as it relates to breast cancer? Do we have the number of, or the percentage of female on the plan who have not gone to do their breast exam? Because while it's a wellness benefit, we do know that employees are not taking advantage of this particular benefit.
So we're at, Ms. Taylor, we're at 59% of
59%.
age and appropriate women have had a mammography last year. And that is below our typical
Again,
benchmarks.
it was how much?
59.
59%
Have not.
have had it. So
So
41% have not.
Okay.
Yep.
And that is below the book.
That is below book of business, and we've internally, collectively with the board and Division of Personnel, set some goals to improve that. We'd
Yes.
like to cut that 41% basically in half
Yes.
going forward.
And I mean, that should be, once again, we should be pushing that strong to each other. I could tell you the strongest people are the women in my life, right? Traditionally. And those women end up dropping dead because they take care of everybody and nobody takes care of them. So we got to make sure we push our matriarchs, our family, our women in there. I want to make sure I can't watch the time, but I also want you to talk about what mental illness is doing in our community. And it really shocked me, the amount of the growth in terms of people accessing healthcare, EAP and the other one, and then the compliance rate with what you're going to do, because this is a very small community, and we often look at the people walking around the street as a mental illness problem. But people are suffering from a variety of maladies brought on from stress, inflation, family issues, and everything else that's going on.
Certainly mental health support needs a significant issue amongst the population and within this group and just in the territory itself. We're up to about 10%. So you're talking about over 2,000 individuals having at least a claim, and that's not including EAP, that's not including any community services, that's not including, as you were saying, Governor, the undiagnosed, right? Just walking around. Stress, anxiety, depression, the top issues that people are looking for help with. And
Have you seen an increase in that number since COVID? Because I know at Division of Personnel, when we're looking especially at donated leave programs, I've seen a lot of individuals coming in with some of these same top conditions here under mental health. So have you seen an increase since COVID?
absolutely, that's been something consistently across the country, not just in the population here. Mental health support needs have just been moving higher and higher and higher. And that's, like Dr. Vitiello was saying about identifying chronic conditions, that's not necessarily a negative, right? To get someone in to a counselor or a therapist and getting the support they need, but it absolutely is moving higher everywhere in here, especially amongst our kids.
So with it being high and having a conversation at the board with Division of Personnel and Cigna, we have gone together with Cigna. Director is going to charge to get 30 people out of the HRs to be mental health first responders so that they can identify employees who are having that issue. It's different aspects as a supervisor, as a leader. You have someone that comes into work, they're always dressed, they're well-groomed, and today they're just busted. The next day, they're very distant. You as a leader have to identify. We're going to have you trained to identify and give them the information and the support to go and get the help that they need before it gets bad. We have the conversations, we're reaching out. EAP is awesome. Employee Assistance Program does more than mental health. It does for grief, it does pet care, elder care, mental support. You get 5 sessions free, and after that 5 sessions, if you still need to go, you can. It's very covered, and as the employer, if we see someone in our employee, we have that conversation. DOP, we reaches out and they will say, listen, you can come and go on EAP, you have a drug addiction, alcohol, emotional, you're not going to lose your job. Let me reiterate that coming from the board. You will not use it if you voluntarily go on EAP. It's when you don't, then it becomes a problem.
Can I also say that for critical illness, if you have a critical incident at work, somebody dies unexpectedly, then we allow for you to have those services, 2 hours. A counselor can come in and speak to the agency about the situation. So it is free, and we try to make sure that we indicate to our employees, utilize it. I think it's a stigma about people not wanting to talk about mental health issues. And so we need to break that stigma and let people know it's okay. There is help if you need it.
But you know, it's weird, right? Because I always say, like, I'm a middle-aged male, right? Like, there should be a manual, like, to tell you what's normal and what's not normal. Because if you're not talking about it with people, then you don't know what's normal. So what's a normal amount of stress? And, you know, this is indicative here where you're saying our base rate of reactive stress disorders is at 45%. And now we're at 48, right? Like, people are under, and I used to take it personally as a governor, like, all of this is my fault. But when you look at people at 5 o'clock, you deal with people, you see how they react to different situations, you understand that they have a lot pent up inside. That's not normal for you to be so stressed about everything. So they don't even know that they're dealing with it. And sometimes it's like boiling the frog. Like, if you're in the water, you don't feel it till you get out of it and be like, oh my God, I didn't realize I was under that much stress, you know?
So thank you for going there, because I did want to make the point that the most prevalent condition is a reaction to something. So they call it reactive stress disorder. So it's not the stress, it's how you react to the stress. And so there are techniques that can be taught and learned. And that was why the availability, I believe, of virtual care has been a huge benefit, because you can access that within minutes or hours, as opposed to calling and waiting, you know, days to get to a doctor. You can have your reactive stress dealt with in a more imminent way through the virtual care, which
so, like,
people are accessing.
Example of that, like how somebody would have like a reactive stress.
They get a piece of bad news, and they're not capable of handling, you know, another little piece of trauma on top of their bad day already, and they snap. You know, they can, worst case scenario, they think to kill themselves, which, you know, obviously needs an immediate intervention. Right. Or they get into a bad habit, or they get into a substance or whatever as a way of assuaging their stress. Right. That's not a healthy way of doing it. So the concept of having access to virtual care, whether it's a psychologist just to talk to, or a group of people who are like you, that you can vent, whatever works for you, because it's your unique reaction to the stress that's causing the illness. And that's why a disease is actually termed disease, right? It's dis-ease. Something has upset your ease.
Right. I never thought about that. Yeah.
That's why.
But you know what? After COVID, you know, two things. Another reason why we started Healthier Horizon, one of my favorite seniors came and said to me, she said, you know, Albert, people need to get out of their houses and talk to people. They've been locked up for 2 years. They're not seeing anybody. You know, it's always amazing. I don't have the benefit of having my two parents alive, but it's amazing how many people here are living elderly by themselves, and the kids don't check on them. Yeah. It's like, you know, you got to have interaction, because it's important to their mental well-being as well, too, to have somebody, because you get so stressed out. And I know I looked through when I read, I didn't see any correlative stress triggers to social media. We've had a high rate of suicide for us. Like, social media as a stressor, people are looking at that, whether it's bullying, cyberbullying, or just, I talk to people all the time who said, did you see that thing about me? And I'm like, see what? And they're like, oh, somebody posted something on WhatsApp about me. And people take it different, you know? For me, I really don't care, because it's not the truth. But for a lot of people, it's traumatic to have their business, or so it's not even true most of the time, about them being posted. Do you think that is adding to this?
Absolutely, and it's by design. These apps, social media in particular, and I've seen the studies, are designed to elicit chemical reactions in your body, working with hormones like dopamine, oxytocin, serotonin, which we know is a precipitator of depression when it's low, and adrenaline. And adrenaline, you know, makes people excited and anxious. So if you're playing with those hormones, it's very likely that if you're susceptible and you have a little change in those hormone balances, you can have a severe behavioral break.
You know, it's interesting you say that because, you know, I tell people, like, they always ask me if I've seen this negative thing or if I've seen that. And I said, no, I never saw it. They say, you didn't see it on Facebook? I said, no. But the social media runs algorithms. So the social media knows what you like. So if you keep liking negative stuff, it's going to keep sending you negative stuff. The little things that we do that will help your day go easier, turn off the notifications on your phone. It's like if I listen to every WhatsApp notification, every news notification, I'd be a nervous wreck. But mental health is something that is really, and it's not only like the bipolar, schizophrenia, it's a small stress that's creating a real problem in our community and how we deal with one another.
That's why it's adversely affecting the younger population more than the older, because they're more likely to be involved in those activities.
But Dr. V, when we were in class, if we count every fifth person should be diagnosed with bipolar. So 1, 2, 3, 4. Ooh. And that's what they say chemically.
Yeah.
So, and then you go to the 10th person, and that would be schizophrenic. So everybody copes different. So, and the governor is correct. What you may look and see and be like, I could care less about it, to someone else, they sit there and they stress. And then we live in an era with social media. Before, it was word of mouth. Did you hear that? And then it dies off. Now with social media, 2 years ago, you remember, so it brings it right back to the forefront. And if you haven't addressed it, and we're talking about mental health, but mental health, if you don't get a handle on it, is going to deteriorate other areas in your body.
And people who think they're your friends, they're calling you on the phone to ask you if you saw it. I mean, how is that helpful? You know?
If that stress is going to bring your blood pressure up. Yes. You're going to eat out, then your sugar is going to go out of whack. One reaction has a different reaction, and we need to get it. But here we're trying to let you know your plan is an awesome plan. You have the tools to save your mental. It's just that first step in putting you first. It doesn't mean you're crazy. It doesn't mean you're nothing. I need to secure my mental. I need to be the best me for myself and for my family. So I just need to have a talk. So you're going to have that conversation. Go with a doctor and just breathe. You know, I need that 5 minutes, 15 minutes of counseling. It's fine. Just go and do it. And with the help of the governor, we can execute it even better.
So while those options are available, and we have options to go to a healthcare professional for that, we talked a little bit about EAP and the sessions that's available from the privacy of your own home. And in addition to that, those sessions are not only available to the employee, but anybody within their household.
Correct.
Right?
And I think it's great, Director, to let them know. If my brother is living in my household, he's not on my plan, but I'm seeing him have an issue, he can go and get the service under EAP. So it works for that family member that's living with you that is going through some kind of issue and it's stressing you out. Get them help, and overall, it will better their body.
Do we know that when we are stressed and we work out, that helps us? I can testify to tell my director that that work is very stressful on itself. Yes. And so I made the personal decision that I will wake up every morning at 4:30 and I will go to the gym every single day except Sundays. Because my blood, and I don't suffer with hypertension, but every time I would check my blood pressure, the numbers would be high. But now that I'm working out every day, my numbers are excellent. So when we work out, we improve our overall health. And that's a benefit to the members that's on the plan. A simple walk. Just go to the gym, walk 10,000 steps every day. It improves. I'm trying to encourage my director to join me in the gym every morning.
Your point is right. It's an individual thing. And yeah, you're burning up the adrenaline and you're making new blood vessels so your pressure can go down. But someone might look at that and think that's an OCD type of behavior and say that's their behavioral issue. So the point I want to make, it's a healthy attitude for sure. Everything's on a spectrum, and everything is individual. And that's why it's so important to have a primary physician, someone with whom you can have a talk and understands you as a unique individual. And you solve your own problems. That's why you don't have the disease. You figured out the way.
One of the things that I really wanted to do and why I'm stressing this health a lot is because we have a universal healthcare system. No matter what's wrong with you in the Virgin Islands, we're going to take care of you. And we eat the cost. But ultimately, when you look at this, a lot of the stuff that we're going through is avoidable.
Yes.
Right? It pains me to get up and get on my Peloton. But after the workout, I feel great. You know what I'm saying? When I go road biking, it's hard to wake up at 4:30 in the morning. You don't have to do it at 4:30 in the morning. Take a walk. Do the other things that help you. One of the things that I think is interesting and something that we really need to keep an eye on is during the 5 years that I've been governor, we have actually lowered the median age of government employees. So only 47% of our population is over 40 years old. That was interesting to me, especially because people aren't having as much kids as they used to have. So when people are young, you think you're invincible unless you have some kind of traumatic life event or something like that. I had a little scare when I was in my 20s that made me respect the doctor. Are our young people going to the doctor? Are they getting checkups? Or who's going and getting these checkups?
Rick has the definitive answer, but I know that you have about 14% of the population who have not received any care at all. And those are the population that might have something. They're probably the young who think they're invincible, but they also may have something too. But that number is 14%, I believe.
You're spending. I told a guy one day. I said, I spend like $5,500 a year on healthcare. He says, wow, you spend a lot. I said, well, how much do you spend? He says, I only spend $250 a week every payday. I said, you're spending $6,000 a year. This is money you're paying. You go to the doctor. You're paying for it. This is the only place you want to go where they say nothing's wrong. Everything's good. There and a mechanic. You could go and they could tell you nothing's wrong. Some people are afraid. That's an anxiety in itself. As soon as I get to the doctor's office, my blood pressure goes through the roof. And I see that machine, I'm panicking.
Yep.
So as a clinician, I would be remiss if I didn't expound on this concept of healthy lifestyle.
Right.
The exercise for sure is important. We know that if you add healthy diet on top of exercise, you can affect the illnesses including dementia, hypertension, obesity, diabetes, musculoskeletal, you name it. Almost every illness that would be listed in the chronic category that doesn't come out of a lightning strike and kill you can be managed by those two things.
So Doc, pork chops with gravy and rice, that's a healthy lifestyle?
I'll leave you with this final tip. Less than 1% of the population, and it's actually less than 0.5% of the population, follows what would be considered a healthy diet.
Wow.
And that's just not your population, that's the world population. So imagine the opportunity, the rock that we can look under for more healthy behavioral changes. It's combination of exercise and diet.
But I think the whole thing is right, and I would like to have this conversation because right now I'm like 20 pounds heavier than when I started, which is not good, so I'm trying to lose it, right? But I'm trying to find that balance where I have regular exercise that is not like debilitating to my lifestyle, that I can eat and not feel like I'm a goat, and it's difficult. And I think what we do a lot is we try to go to the extreme. And that doesn't work. So you want to do something that you can maintain and you progress over time because to Valerie's point, you start to feel good once you start to get healthier,
It needs to be a lifestyle, not a diet.
Can I share something, Governor? So, I was exercising and I wasn't losing the weight. But then my doctor said, you need to strength train. You need to lift weights. I got in the gym and I started to strength train and lift weights. and I dropped weight. And you do not want to wake up at 4:30 in the morning and then drink a soda or eat chips or eat cake or do those crazy things, because then it defeats the whole purpose of you going to the gym and working out. So
I'll be honest, I exercise so I could do bad things. I'll just be honest with you, but I see your point,
Yeah.
you know?
So I want to kind of shift us a little bit. In preparation for this, we sent out a survey to the GBI population, and we received some feedback. So I want to make sure that we throw in some of the questions that some of the employees had. So I'm going to throw these out to the panel. One of the questions and concerns was, can we modify the policy so that one of my multiple annual doctor visits and blood tests due to my cancer diagnosis counts as a physical/annual physical?
I'm not sure that any of us would be experts on those plan decisions. However, I can say that if you have a diagnosis, if you carry a diagnosis, you can still have a general exam, but if the problem of the diagnosis in question comes up during that exam, it does not become called a preventative exam anymore. And that's kind of the rules of the road, and to change that, I don't think is actually possible.
Okay, so next question, and I think this might go to the board chair. Is it possible to offer more plan options for premium payment, such as a single employee and a spouse, or a family of 3, and a family of more than 3, while requiring all members and dependents to participate in the dental plan?
So, good question. I think this person might have been in our board meeting on Thursday, because this came up, and the governor's policy advisor, this was one of her recommendations, if the board can look into tiering the plan. And we have charged our consultant to bring back the data to us to see if we tier it, how is it going to cost for those families? Because it was mentioned, and it's factual. Some employees feel, I have 2 people in my household, I should not be paying a family plan as someone who has 5 and 6. So we're going to look at the data and bring it back and see, one, making sure that it's affordable, because you don't want to compromise someone, because remember, this is someone's salary. From a 32 to a 45, you have to take into consideration and then the overall cost. So we are looking into that. And for the all members and dependents participating in the dental, they do. Your dependents are on the plan, and they get the services that's rendered under the dental as you as a policyholder.
I want to make some comments on that, because in my master plan for policy control, a lot of it is around poverty and doing things about poverty. And in my experience, the more affluent the individual, the more likely they are to be educated, the more likely they are to eat healthier and have the access to do it, the more likely they are to go to the doctor. When we tier the plan so that it's by dependence, and the other thing, they are more affluent people have less children. Right. So what it does is it puts the burden on the least financially viable people to have to come up with more for insurance. And that's why I like the plan the way it is now, because we spread the cost. And I say this because ultimately, I would like us to start to look at healthcare in the Virgin Islands, the administering of healthcare a little different, so that everybody will have access to the doctor and a health plan and a pharmacy plan. Because if you're not covered right now by the government insurance or Medicaid, and you get sick and you can't pay for it, we pay for it anyway. Yes. So why wouldn't we, as a government, make sure that everybody has access to preventative care? And I actually got this idea from Cigna when we went to Florida, right? Yeah. And we toured one of the preventative healthcare places, and I said, this is what we need. So access is so important, and we have to realize it's a community where 30 to 35% live below the poverty line. And I would say the Virgin Islands poverty line is probably more like 40, 45%, because things are just that much more expensive, especially on St. Thomas and St. John, that we have to figure out ways to ease the burden on those. That's what, because people don't, I ask people sometimes, they say, man, I can't afford this. I have 7 children. I said, well, how did you get 7 children? You know what they say? God gave them to me. No. Even to the aspect of family planning. So if you're already poor and you don't have access to health care, you don't have access to the best schools, and you don't have a healthy lifestyle because you don't have the education in order to plan and eat properly, you're more likely to get sick. So it just behooves us to go to those people and give them more services. And you see it in our community every day. I grew up thinking vegetables all came in a can, and there was only one kind of lettuce, iceberg. And I mean, people laugh now, and I'm not ashamed to say this. We got most of our healthy stuff off a tree. I mean, our entertainment was climbing a tree and eating all the food on the tree. But those days have changed, so we have a lot of education to do, and I think the GEC and certainly Cigna is helping us with a lot of that.
If I might add a point there, one of the other groups that needs education are the physicians, and we are making a conscious effort to provide hours of continuing medical education on some of the things that you've talked about, whether it's diet, exercise, or other ways of handling illness in addition to medication, but most docs are not well trained in some of the lifestyle stuff. So
I want to ask you a question. Have we ever done, well, we couldn't do it on a school level because we have so many Cigna participants in our public school system. Have we ever done anything on a school-based level to administer care of the GSE initiative or anything? Because one of the things that, like, if we could get the kids, and it doesn't have to be actually care, it's just dietitian, what you eat, how you eat, those kind of things, exercise habits. Creating culture changes starts with children. Right. And I think that's where our opportunity lies too in trying to create this healthier horizon, trying to make sure that people don't get sick.
So we have, and I will say DOP, not last year, the year before, did a proposal where they wanted to go into the school to educate and reach that population. There is just some tweaking that needs to be done. Yes. That
and we still have the senior program?
Yes, we have the senior. We did a soft opening for our building on St. Croix, located in Scion Farm next to Heirs R Us. I haven't done the big one, so you can come and cut the ribbon because we need a name. We have not decided on a name yet. I want it more than just a wellness, because inside they do the boot camp, they're doing the cycling, it's body shaping, we have the aqua fitness, but we also created a Zen room, and I got that concept from UVI, Innovative Center. So our massage chair is on the way to go into that room. If you want to put raindrops, birds chirping, you can go in there, massage and just meditate. It's not like Valerie said, sometimes it's not exercise I need. I've had a stressful day. Before I go home and blow my top, I can just go in that room. It's air conditioned, you want the lights on, you want the birds chirping, you sit there, waterfalls, and just woosah. So we're doing a lot as a board to work to the members to bring just mind, body, and soul is what Roberta Etienne calls the overall program, and it's awesome. So on St. Croix, UVI and Division of Personnel team up over here. We're still looking for a building here, but we were good to get the building on St. Croix done up and functioning. The seniors meet at Cheney Bay, and they also go midday in the building and do their exercise. I've seen the class. Those retirees are beasts.
Yeah.
So
retirees are whole lot of,
they does be squatting and pushing, and I'm like, man, I got good for you. But it's not me. I'll do the aqua fitness on a Saturday. That's as far guided meditation. So the overall plan is awesome. DOP and our other individuals that send in proposals, we try to keep it up. I did get one that asked if we could go back to doing the healthy cooking. Yeah. So
nice.
we could go back to do the healthy cooking.
Come on there, so you how to make pork chops.
But I want to interject, Director, if I may.
Yes.
Because we do have these initiatives, and our employees register but then they don't show up.
Yes.
We want to encourage our employees to not just register, but participate so that you can get the overall benefit of the program. And so we are pushing to make sure that we get 100% participation from government employees.
How much time do we have left? Anybody knows? Because I want to make sure we got 6 minutes. I want to talk a little bit about costs, because that's another thing that is important. And for the last 5 years, the government has essentially absorbed all of the increases. Some years we didn't have any increase at all with our healthcare plan. But when we talk about healthcare, feel free to jump in here and correct me anytime I'm wrong. We have the Cadillac of healthcare system, of a healthcare plan. We have a really good healthcare plan, so you need to use it. On average, though, our deductible is lower, right? Our deductible is lower than average. Our premium is lower. And I looked up last night, we're just about average in terms of employer share of the plan, because now we pay 72%, 73% of costs. So, you know, everything is more expensive. I was looking at the catastrophic illnesses. Those clients are costing us $264,000 a year. Is that about right? I remember statistics very well, but $264,000. When you think about keeping yourself healthy, the average government salary is $50,000. That's 5 years of salary for one person. That's what we're dealing with. So we want to see you around. We want to see you live. And we have to live, all of us in this community. But if we all just take our medicine, exercise a little bit, slux a little less, we're going to be good to go, right? I mean, you get sick anyway, right?
Yeah.
But we can cure stuff.
Yeah.
We will get better, but I think too, Governor, minus your working class, your hazardous employees need to take stock of their health.
My brother's
They
a
are the
paramedic.
least to take stock. They need to formulate doctor. They need to increase on their supplemental insurance. They just stick with a bare minimum of the 10,000, and they are the ones that's really out there. They're fighting crime out in fire, EMT. You put your life on the line, but you got to put your overall health first. Do your annual visits. It's there in your contract. Go and do it, because at the end of the day, we always say we do it for the family. But if you die, you leave your family without.
But not only the physical, because I worry about this. As I said, my brother's a paramedic. The mental,
Yes.
seeing people getting shot, people dying, the trauma of going to somebody's house and something's happened to the kid, like that's a lot to be carrying around. So your mental health as a first responder, and keeping yourself in good shape, because I mean, the more back injuries and workers' comp, I see them all the time when I was labor commissioner, and the amount of lost time that we have due to injuries because of people not keeping themselves is a lot. But I wanted to make sure that people had an opportunity to see and listen to what's killing us. And you have an opportunity to say, listen, I'm gonna do something about that. Just even if you just do one thing, just take your medicine and take your physical every year. You know, I think we'd be a lot better off.
So, you know, we covered a lot here today, and we actually probably could have sat here for a whole another hour or two. And, you know, we also did a survey, and we got a lot of feedback from our GVI employees. So we want to make sure, too, that we do respond and give them the answers. So we are going to take this into consideration. We might set up a platform where we can actually answer some of the questions, because some of them were really good. We didn't get to touch too much on dental, but we want to make sure that we do cover everything. So it's important, again, that you take in everything that you've heard here today. I want to thank all of you, of course, for participating, and do know that this administration does take the health and wellness of our employees and their families seriously. So I want you to take advantage of everything that the Division of Personnel, that comes out from the Division of Personnel, the GSC board, the entire administration, because we do wellness from sports, parks, and rec, out of the Department of Health. And as I said, it is a serious thing. And we wanted to share with you what our plan looks like, what drives it, and what's yet to come. So again, do visit the Division of Personnel, visit our GVI Wellness page on Facebook, and take advantage of all that we have to offer. And thank you again for watching.